Welcome back. Whether you are nearly approaching 65 or you've already had Medicare for years now, the open enrollment period is an important time of year. Today, we are sharing what you need to think about when making your Medicare choices. Joining now with some advice is Karl, the Vice President of Growth for People's Health. Welcome to the studio. Oh my goodness.
Thanks for having me.
Thanks so much for coming on. We've done virtual interviews for years, and now look at you on the couch. And listen, the time is here. Once again, everyone, open enrollment is going on right now. It started yesterday, October 15th. Let's talk dates. When does it end? And for people who are turning 65 for the first time, obviously, this year, what do they need to think about before they even start looking at their options?
Yeah, so the annual enrollment period started yesterday, as you said, October 15th, and it runs through December 7th. And those are for people that have been on Medicare for a year or for years. That's their annual time that they can kind of review their coverage and make changes to it, and it would start on January 1st. For somebody just aging into Medicare, they have what's called their initial enrollment period, which runs really 3 months before their 65th birthday, the month of, and 3 months following. So they have a 7-month window that they can elect how to receive their Medicare. And the decision is a big decision, it's driven by many different things. Cost, by what, doctors and what doctors they want to see, and it's really up to that person to decide how they want to receive their Medicare.
It's so true. So look at your options, and just so you all know, the changes do go into effect on January 1st. My mom is so excited. She called me when she got information about her Medicare. She's like, woohoo, I've made it to 65, and she looks good. Okay, so congratulations to everyone who just turned 65 this year. Now, like you just alluded to, one thing you need to know is your options, right? Look at the costs, look at the extra benefits. Talk to me about what we should be looking for in that regard.
Yeah, so there's so many different ways that you can really receive Medicare. You can receive it via original Medicare, which is through the federal government, and it covers kind of your basic doctor's visits, hospital visits, those types of things. And then you can receive your Medicare through a Medicare Advantage plan, which is a private health insurance company that contracts with Medicare and offers everything that original Medicare offers plus. So it offers things like dental, vision, fitness center memberships, healthy food on some plans, over-the-counter items. So there's a number of things that people can receive via Medicare Advantage plans, or they can even get a Medicare supplement plan, which kind of is a secondary to original Medicare, where they pay a premium to cover their things. And then on top of all that, there's Part D, which is your prescription drug coverage, which comes on most Medicare Advantage plans. But if you're on original Medicare, you have to choose a plan and pay a monthly premium for that.
And I'm glad you're breaking all this down, because since we're in open enrollment right now, you're going to be seeing commercials all throughout different television stations. So it's good to know that there are options out there. But how do we know which one works for us? Is it all about really what we can afford? Can I just afford regular Medicare, or can I also afford Medicare Part A, B, C, and D?
Yeah, so that's ultimately one of the main things that drives somebody's decision is cost. And you get A and B on original Medicare. That's really kind of Part A covers your hospital, Part B covers your kind of doctor's visits in a very simple way. Part C are the Medicare Advantage plans, which cover your A, your B, and your D, all wrapped up into one. And then Part D obviously is your prescription drug coverage. So somebody has to look and really make a decision on what's most, if they travel a lot, maybe maybe original Medicare with a Medicare supplement. If they don't travel as much and they stay here locally, and a Medicare Advantage plan might be the best fit for them. So it really is driven by the decision that is best for that person.
And you're sharing some great information for people who, again, like my mother, just turned 65, looking at Medicare now. But let's talk to the people now who maybe have been on Medicare for 10 years now. If they want to change something in their plan, how does that process work?
Yeah, so right now they should have their annual notice of change. So by October 1st, that should be in their mailbox, telling them any changes, both good or bad, to their plan that they're currently on. And they have from October 15th through December the 7th to change. So they should go online, take a look at the different plans available, maybe call their sales agent and take a look at what things change year over year. And this year there's a lot of changes. So they should take a look and see what best fits their needs financially, again, with providers, with their Part D and prescription drug coverage. There's just a number of factors that drive that decision and what's best for them.
Now, say we get to December 8th, right? Open enrollment is over and someone still needs their Medicare. Is there any exceptions to reopen enrollment ever?
Well, there are exceptions, and there's what's called special enrollment periods, where if somebody moves, to a different service area, they're eligible to change. If they have Medicare and Medicaid or low-income subsidies, things like that, they do allow them some changes. But it's really, think of it along the lines of your health insurance through your employer, right? You have to have some sort of life-changing event for you to be able to change your plan, and that's really how it works.
It's so important to know, but let's not wait until December 8th. Okay, open enrollment is going on right now, so let's do it now rather than later. Nick, so good to see you in person. Thank you so much for being here. And listen, everyone, if you want more information about the open enrollment period for Medicare and how People's Health can help you, log on to peopleshealth.com or call 1-800-315-8782 for more information.